joint and a little bit on development. So common injuries would include cartilage tears. These usually have to be repaired with arthroscopic surgery. Here is a picture of an using arthroscopic photographs of a torn medial meniscus. Sprains would be when the reinforcing ligaments are stretched and torn. This commonly happens in the ankle, the knee, and the lumbar region of the back. There's really only three options if it's torn completely. Usually the ligaments have to be sewn back together. In a worst case scenario, replaced with grafts. You can try to allow time and immobilization for healing, but generally ligaments do not repair very well. A dislocation or a luxation or subluxation be partial. Are the bones forced out of alignment? This is going to be accompanied by sprains, inflammation, and difficulty moving the joint, usually caused by a serious fall or a contact sport, and they have to be reduced in order to be treated. They should be reduced by a qualified, trained individual. So some inflammatory and degenerative conditions would include closely related to each other, bursitis and tendinitis. Bursitis is inflammation of the bursa. Treat that with rest and ice, anti-inflammatory drugs. Tendinitis would be very similar. The tendons and the bursa are very close to each other. Overuse is a common reason for tendinitis, and you treat them similar to bursitis. Arthritis is actually a collection of diseases. There are at least 100 different types of this inflammatory or degenerative disease that damages joints. It is the most widespread crippling disease in the United States. Symptoms would include pain, stiffness, and swelling of the joint. There are some acute forms that can be caused by bacterial infections, which usually respond to antibiotics. There are also some drugs whose side effects can lead to an acute arthritis, and discontinuing those drugs would stop the arthritis. We'll focus on some of the chronic forms, the most common being osteoarthritis, and then rheumatoid arthritis, and then we'll talk about gouty arthritis. Osteoarthritis is the most common type of arthritis. It's thought to be a wear and tear arthritis, may be contributed by excessive release of enzymes that break down articulate cartilage. Once that cartilage begins to be broken down faster than it's replaced, bone spurs or osteophytes can form on the thickened ends of bones. And by age 85, about half of all Americans, more women than men, will develop some level of osteoarthritis. It's probably part of the normal aging process. The joints that make stiff, crunching noises called crepitus, especially on getting up in the morning. So this is the type of arthritis that hurts worse in the morning, and as you start moving, it gets feeling a little better. So one of the treatments would be moderate activity. Mild pain relievers and capsaicin creams have shown to be effective. We'll say that things like glucosamine and chondroitin sulfate, all nutritional supplements, and there are many of them sold out there, there is absolutely no evidence that they are any good at treating osteoarthritis or any arthritis at all. Rheumatoid arthritis is a chronic inflammatory autoimmune disease, so our immune system is attacking our own cells. Typically arises in the fourth and fifth decade, but can occur at any age. 3 times as many women as men. In fact, I will tell you that one of my sons has rheumatoid arthritis, juvenile rheumatoid arthritis, and juvenile rheumatoid arthritis in children, is second only to asthma as far as an inflammatory disease of children. Symptoms include joint pain, swelling, usually on both sides, anemia, osteoporosis, muscle weakness, and cardiovascular problems. So we feel it in the joints, but rheumatoid arthritis is a systemic disorder. Begins with inflammation of the synovial membranes called synovitis. On the affected joints, the inflammatory blood cells migrate in, release inflammatory chemicals that can destroy the tissues. That leads to accumulation of synovial fluid causing swelling, and that inflamed synovial membrane can thicken into a structure called a pannus that clings to the articulate bone. Eventually, that pannus will erode the cartilage, forming scar tissue and connecting the articulate ends in a process called ankylosis. So treatment would begin with non-steroidal anti-inflammatories. If it doesn't respond to that, we can move up to steroidal anti-inflammatories, and now we have some new classes of drugs that will target the immune system itself. Immune suppressants, tumor necrosis factor blockers can help. And their treatments for rheumatoid arthritis are much improved even over the last 20 years. We don't see hands that are deformed in this way anymore like we used to. That's good news. Gouty arthritis results from uric acid crystals being deposited in joints and soft tissues, which leads to inflammation. This one is more common in men. Typically affects the joint at the base of the great toe. Eventually, in untreated gouty arthritis, the bone ends fuse and immobilize the joints. There are some treatments for this. There are drugs that cut down on uric acid. Drinking lots of water, avoiding alcohol and foods high in purines is recommended for people who have gout. Gout is actually commonly caused by a genetic mutation so that you don't break down uric acid correctly. Lyme disease is caused by a bacteria that's transmitted by tick bites. It leads to skin rash, typically the bullseye rash, flu-like symptoms. That can lead to joint pain and arthritis. A long course of antibiotics typically gets rid of the bacteria, and for most patients, not all, but most patients, those antibiotics also get rid of the Lyme arthritis. Developmentally, by embryonic week 8, synovial joints resemble adult joints. The size, shape, and flexibility continue to modify with youths. Active joints have thicker capsules and ligaments. Advancing years take their toll on the joint. The ligaments and tendons shorten and weaken. Intervertebral discs are more likely to herniate. Most people in their 70s have some degree of osteoarthritis. Full range of motion exercise is key to postponing joint problems. And that wraps up this chapter.